So coming to the last part, we're going to talk about the management. Management overall remains the addition of thyroid hormones for especially when patient comes in with symptoms. Taking synthetic or natural has varied effects, as the autoimmunity can be rampant or mild. Constantly changing the dose to manage symptoms has been the biggest challenge. Normally, I would do a complete assessment of the thyroid stimulating hormone TSH, T3 and T4, and reverse T3. Now, if T4 and T3 are low, then I would include a T4, T3, either a combination like synthetic would be levothyroxine and cytomel, or I could compound it into a capsule, or do natural, which has T3 and T4. I prefer synthetic because the dose is very consistent, and sometimes I find most patients respond well to synthetic. There are others who just do not like synthetic. Now, natural the tablets sometimes are compounded with iodine, and if you have Hashimoto's, which Hashimoto has been known, as I mentioned before, in iodine replete states rather than iodine depleted conditions, it may actually keep the Hashimoto's flared up. Avoid iodine unless testing shows you may be deficient in this. If you have a urinary excretion of greater than 220 micrograms per 24 hours, then that may be responsible for the autoimmunity or Hashimoto's. If there's an increase in reverse T3, which is the bad twin, as mentioned in a previous article, so it behaves just like T3 but does not have the effects of T3. So it actually creates a low thyroid state. You may have to focus on the gut restoration. So really focusing on avoiding gluten, focusing on vitamin supplementation. So if I take the whole picture as such, we're going to do nutrition support, which means very plant strong, less animal protein. And this may be against the paleo and the ketogenic diets, but there are enough studies that show being plant strong, having a lot of fiber, promoting good gut bacteria really helps with the thyroid. Selenium and fiber rich foods, gluten and iodine free. So no iodized salt basically. Detoxification of the gut and the liver helps. So I check ferritin levels to see where we are on that. Assessing other hormones like insulin, cortisol, leptin, and adiponectin. Managing stress with meditation, exercise, Epsom salts, journaling, having some structure in life, making sure you have good sleeping habits. Optimizing an exercise program that does not activate the immunity, so you're not hyperactive, but you're actually doing maybe yoga, Pilates, something that is very calming for the body.